Welcome to the ASH 2014 update here in Zurich. We will talk about indolent lymphoma and chronic lymphocytic leukemia, and we welcome Professor Stephan Schuster from the University of Pennsylvania as our first speaker. So Stephan, it's a pleasure to have you here again this year. You said it's your fifth or sixth time to be at the ASH update here in Zurich. And again, you were covering the topic of indolent lymphoma and CLL. So in brief, what's your most relevant take-home messages in indolent lymphoma from the ASH?
So in the indolent lymphomas, I think that this year some new paradigms were presented that we will see developed over the next several years. And I think that those paradigms involve new technologies, immunologic technologies like chimeric antigen receptor modified T cells, immune checkpoint inhibitors, specifically PD-1 blockade. I think that the types of studies that I reviewed tonight and that were presented at this meeting were early phase studies that were done primarily to look for signals. And I think the signals were there, and we'll see the mature data emerge. Interestingly, the CLL studies I presented were not studies that were presenting new paradigms. They were just refinements and expansions of the existing tremendous successes that we've had in the last several years with kinase inhibitors, specifically ibrutinib, and then some larger looks at maintenance, rituximab, et cetera. But I think what was presented in the indolent lymphomas that was so significant were these small early phase studies that show new approaches where there's a real signal. And in maybe 2-3 years from now, the kinds of studies that we were discussing in CLL will be discussing in lymphoma using these new approaches. I think the other thing that was interesting that came out of the meeting was that clearly the indolent lymphomas and CLL are different diseases. I mean, the same types of therapies have activities, but to different degrees depending on the modality. And specifically, I'm referring to ibrutinib in follicular lymphoma versus ibrutinib in CLL.
Yeah. So it was pretty much that 2-3 years ago the new drugs came for CLL, and now the next wave is for indolent, and we see there are differences. Yep. And as you said, it was much more about data presenting what will be the future and not so much practice changing right now.
For indolent lymphomas, this was the year, once every decade, there's a meeting where the presentations are almost visionary. They're small, early phase toxicity studies, but yet they send a signal. And then the efficacy studies get designed, the larger studies get designed, and within that decade, those technologies emerge. So I think we saw, for the indolent lymphomas, a couple of signals that are pointing technologies that will become greater developed over the next few years and maybe be practice changing in the future, and likely to be practice changing. In CLL, we're seeing drugs that became practice changing, and we are intensifying our knowledge of those drugs within cytogenetic subsets, et cetera.
So coming to CLL, I mean, we were always a little bit, how shall I say, negative or not so enthusiastic about the use of CD20 specific antibodies, because it was always said they CLL cells don't express much CD20, and probably the effect is not as much as in other lymphomas. Now CD20 antibodies are part, at least in the immunochemotherapy regimen, and now even we have 2 trials on rituximab maintenance in CLL. So what's your take-home message on that story?
There were 2 interim trials. One was rituximab and one was ofatumumab as maintenance following immunochemotherapy in patients with CLL. The rituximab was, most of the patients had their first chemotherapy. In the ofatumumab trial, they were second or third remission or partial remission patients. But both studies showed a signal in terms of improvement in progression-free survival, which will probably be upheld as the studies mature. And that progression-free survival was at a very small cost, a very low level of adverse event increment, specifically some increase in neutropenia or infections that if one's on the lookout for, should be manageable. So yeah, it is interesting. But although early on everyone was negative about anti-CD20 therapy, when it was added to chemotherapy, it showed not only an improvement in progression-free survival, but ultimately in overall survival. And now there's 2 maintenance studies which are showing some benefit. Interestingly, these studies are being presented about 12 years after similar studies were done in follicular lymphoma. At least the first maintenance studies are about 12 years old in follicular lymphoma. The PRIMA, et cetera, came later. But, and these are the early studies in CLL.
Good. So thank you very much.
My pleasure.
It was a pleasure.
It's great to be here. This is a tradition now.
It's a tradition, and you came all the way, and have a safe trip home as well.